Well, good evening. On behalf of Best Life Brands family of companies, ComForCare at your side, and Care Patrol, we'd like to welcome all attendees from around the country and Canada to the live presentation From a Distance, Caregiving in the Time of COVID. My name is Stephanie Viazhbitska, Manager of Strategic Healthcare Programs here at the corporate headquarters, and I will be with you this evening. The purpose of this webinar is to serve as an opportunity to have a conversation around COVID. We wanted to take a deeper dive on how it impacts us in terms of stress, grief, and caring from a distance. All these topics present unique challenges that we want to explore and talk about some helpful solutions. In this three-part conversational webinar series, the third and final topic we're going to address is caring from a distance in the time of COVID. Now, it's no surprise to most of us, as we've discussed previously, that caregiving comes with some level of stress that we always have to address. However, caring from a distance can add even more stress for some, given the distance that separates some of us, whether it's just a few hours away or a plane ride away. This distance is stressful enough without COVID, but with it and potential exposures or making sure our loved ones are safe can be daunting for anybody. So as your partner in care, we want to start the conversation and share some helpful information. So specifically in this webinar, we'll talk about the unique challenges of distance caregiving during the pandemic, getting support as a distance caregiver, and some practical tips to ease the stress of distance caregiving that we hope you'll find useful. Now, before introducing you to our speaker, I'd like to run through a few housekeeping items. First, this is a 30-minute presentation and we'll provide some time at the end for questions. And everyone is in listen-only mode. But I certainly encourage you to utilize the chat feature and Q&A. Know that there's a lot of attendees here that are in similar situations as you and might have tips that they can share with you, given you the unique challenge that you have within your own family and your own dynamic. Following, you'll receive resources to consider reviewing that is addressed in this presentation tonight. And now I'd like to introduce the company that is hosting this educational event. Best Life Brands includes a suite of companies all focused on supporting exceptional senior care solutions. The first being ComForCare at your side home care. We have the unique opportunity to assist families and seniors experience in-home care that makes them find meaning and purpose while keeping them safe at home. One of our greatest passions is to guide families and clients through their care journey that introduces caregivers into their lives who care like family. Secondly, Care Patrol's main focus is to assist families and individuals find the right senior care community living options. They help families identify senior living options in their community and can facilitate the entire process from taking tours to moving in. And because of this, they build trust with their clients that is so important with a true life transition. And now for our speakers. So as I mentioned before, my name is Stephanie, and I get the unique opportunity to develop programs here that help our clients live their best life possible. Over the past 16 years, I've learned that teaching and educating our communities like we are here tonight can make a big impact on improving health that I get an opportunity to be a part of that I'm truly grateful for. And our main speaker, who we are so excited to bring to you tonight, Dr. Cynthia Green, is a clinical psychologist and clinical cognitive wellness expert. Dr. Green is the CEO of TBH Brands, parent company of Total Brain Health, a leading provider of brain fitness training, products, and services. A member of the Department of Psychiatry, faculty at the Mount Sinai School of Medicine since 1990, Dr. Green is the author of 6 books on brain health. She serves on the Industry Advisory Board of the International Council on Active Aging and the Optimizing Wellness Committee of the Dementia Action Alliance, and is a frequent media guest. Dr. Green, we're so excited that you're here, and thank you so much for being with us tonight.
Thank you. I'm looking forward to the discussion.
So we talk a lot about caregiving, and previously we had talked about some of the unique challenges associated with that role, but caring from a distance just serves as a different sort of stressor because we can't necessarily check on mom or dad or our aunt or loved one like we used to. So can you help us just understand what some of those unique challenges are that kind of, I guess, all make us feel like some of the things we might be experiencing is normal considering that type of position that some of us are in.
Yeah, and I think, by way of introduction, even just thinking about distance caregiving prior to COVID, which I know we're going to move into talking about, was already had an additional level of difficulty. And, just to preface, Stephanie, as we have in these other discussions, that as we talk about caregiving, we know that everyone who is caregiving is doing their very best, and that it's a daunting job. And so the hope is that this discussion will, just provide maybe some ideas, some conversation about just understanding some of these unique issues and some suggestions for what might help. And those suggestions aren't meant to suggest that someone isn't doing a great job. They're really just given in kind of an open way to see if there might be something else that can help. Sometimes having that conversation or listening to a conversation can kind of percolate our own ideas as well. So I'm really happy, and I know you are as well, as we talk, if folks have ideas or things that work for them to share in the chat, I think that can be really valuable to add to the conversation tonight.
Absolutely.
So, caregiving from a distance is really complex because you're taking on that responsibility of caregiving, but you don't have eyes on all the time. And so there's a lot of things that you end up juggling and managing, and there's a lot of opportunities for something to fall that isn't really in your control. So, for example, a lot of people who care at a distance have this finely constructed, balanced web of resources, from someone who might come in the home to check, to transportation for doctor's appointments, groceries delivered, a whole kind of host of things that can make it work from a distance. And then something can fall apart and unravel so quickly, and it can really throw you and throw your plans. So that there's these unique challenges that come with distance caregiving that really add to that stress that we talked about in the first session that all of us as caregivers can experience.
Yeah. And even just managing, all of those resources, even if you've identified them, can be a lot of work too.
Yep, absolutely.
And of course, distance caregiving during COVID, we've talked about this. It's like that whole new level of worry, right? So as if distance caregiving wasn't challenging enough already, now we have COVID. So whether, our loved one has had exposure to it or potential exposure, or, are they okay? Are they getting enough exercise or even fresh air? I mean, the list can just go on. So help us understand, what some of the issues are even associated with distance caregiving during COVID.
And that those are all absolutely true. And then in addition to that, how many of us weren't really distance caregivers, and now suddenly we are? Yeah. Because even if our parent or loved one is 20 minutes away in a residential community, suddenly because of the pandemic, we weren't allowed to visit. So all of our contact became remote. And we weren't able to have that hands-on that we were used to. So I think a whole new level of worry is the best way to describe this, right? It's kind of like layered on top of the caregiving, layered on top of, if we're caregiving at a distance, now we have the layering of COVID. And, still in many communities, there are restrictions on visiting. We are dealing with travel restrictions. And, sometimes it is also about the safety around travel. So I know my parents live in Idaho. I'm in New Jersey, and we're struggling to figure out how to go visit. My mother is trying to visit my sister in Seattle, and so there's all these kind of new complications, right, around testing and what's safe and what isn't safe. There was the disruption to the balance of resources. Hopefully, in many communities, that has now kind of resolved, but very early on in the pandemic, where we are in the East Coast, there were shortages of supplies, shortages of medications. It was hard to get groceries. So I know that there were a lot of people who may have been caring for their parents, and their parents might be independent in the community, but they were helping them, making sure, checking in that they were getting the food that they needed. And I remember talking to one woman. I volunteered to make phone calls on behalf of a local skilled nursing facility that's a not-for-profit, to touch base with members of their community. And one woman, said to me, "I don't think I have enough food." And it was heartbreaking.
Sure.
And so, we were dealing with that also as caregivers from a distance. And all of it just makes us feel anxious and stressed.
Of course.
And and the uncertainty of how to resolve it can be very problematic as well.
It can. And I think to some of the points of what you just shared, like in the initial part of the pandemic, without even being able to get the necessary supplies, right? So we've seen a lot of that change. So while it's still stressful, I hope that as this continues and eventually, it comes to an end, it's not as stressful, right? So
Right.
Because things are changing and evolving, we have more access to resources.
Yeah, and one other thing, Stephanie, about the distance caregiving and that, because it's so different across different parts of the country, it might be, you might have one kind of set of circumstances around the pandemic in your community, but it can be very different where your loved one is. And that's another source of worry.
It is, absolutely. Yeah. And that's why I think sometimes we like to say it takes a team. Caregiving is a team sport. And so to find your teammates, you already mentioned earlier, finding the right resources to deliver some certain things, just to manage things in a different way that can kind of put you at ease a little bit. But what do you really mean by it takes a team in helping us manage distance caregiving?
I think especially for distance caregiving, you really need to find your support team. Right. And you really need to have a group that is partnered with you to make that a success. And those partners are generally the people who are going to be able to be physically present and be your eyes and ears on the ground, and who will work with you, and where you can work together cooperatively in caring and planning, just to make sure that your loved one is healthy and well cared for. And that was something that was always important in distance caregiving. It's even more important now. And granted, that also has gotten more complicated, right?
Sure.
So you might have had another relative, for example, who now is practicing a lot of distancing and isn't really able to partner with you in the way that they could before. But it's still really kind of the best plan from a distance is to have someone who physically can be present, whether it's other family members, friends, or other support team members that you have as part of that group.
Agreed. So with team, obviously, and building that team, there's even more reasons why, besides some of the things you just mentioned.
Yeah, because we think about, I think when I think about it as these circles, right? So the first circle is in the home itself, right? How safe is the person in the home? Do they have the essentials that they need around food and, supplies in the house? And, how do you know that they're safe at home? And then you go out of that circle and it's safety kind of out to the things that they need from the community, such as groceries and medical visits. And then you go out and maybe then it's, maybe spiritual contacts or other community activity contacts, et cetera, et cetera. So you can think of that kind of growing circle of that team, and who's on that team covering those different parts of your loved one's needs. And then, and I know that it'd be great to have you talk about this a little bit too, is the professional services, because I think that people are not always aware of the role that having a professional on your support team can play, and how much that can ease your mind when you're looking at distance caregiving.
Yeah, and one of the things I always like to talk about when it comes to professional services is that we really focus too on what's called resource coordination. So while there's always core services that a professional in-home care provider might be able to provide, that role of that community integrated partner is to help you identify what resources exist in your community, given the unique needs that you have, and help coordinate and identify and simply help you just kind of walk through everything that is available and kind of put a plan in place to walk you through that process. Family dynamics and distance caregiving is nothing new in home care, just because family dynamics have changed. But I think a lot of times just individuals don't quite realize exactly how they can leverage these types of professional services to really help them and that family, so that at the end of the day, we can alleviate some of that burden and that stress that might be experienced by caring for someone from a distance. So obviously we've talked a lot about just what it means to be a distance caregiver, what that additional stress is like in time of COVID. It's a lot of what we're experiencing today, even myself personally. So a lot of us are faced with this, on an ongoing basis. And so it's really important to look at tips, right? And so I think we always like to say that we always want to share strategies. They may not always work for everybody, but to at least just take this sort of overwhelming concept of caregiving in general, and kind of just break it down so that we can say, okay, we all understand that this is a little bit stressful, but what can we do about it to maybe help us through this process a little bit more? So what are some of your tips and suggestions?
So we have 5 tips to share tonight. And again, as I said, these are not tips that are meant to say, oh, you need to do this, right? They're not going to work for everybody. Some people might have some other tips. We'd love to see those in the chat box. But these are some tips that we hear from those who have done distance caregiving and have shared them, and also from professionals like yourself, right, who have had a lot of experience with different families and different loved ones. So we're going to go through these, plan and prepare, get organized, communicate, identify care resources, and make the most of your visit. And I just love this quote from Edward Albert, that the simple act of caring is heroic. And so I hope that you all have your hero capes on, but we can go forward together and think about some other maybe practical tips that may be helpful.
Great.
So the first one is plan and prepare. And this is, of course, really the cornerstone, if you will, of good distance caregiving. It's really easier if you have a good planning and preparation to start. And, sometimes becoming a caregiver at a distance can be a surprise, right? But often, it's a gradual process, and you can start a little bit on the early side in anticipation of the fact that over time, caregiving will be part of the role that you will play for your loved one. So that includes discussing things like finances and legal issues with your loved one, to the degree that they're able, as well as maybe with other family members. And that would also include discussing a power of attorney in case decisions had to be made on their behalf. It also can be really helpful to identify at least one family member who will have permission to receive important communications. Stephanie mentioned before the idea of family dynamics. For some families, caregiving around a loved one goes smoothly, but for many others, it can be stressful. There can be moments of or areas where family members don't agree, and it can be difficult sometimes to collaborate. So it can be really good to kind of see how much you can get on one page to include everyone that needs to be in the conversation, and then maybe also to then divide a little bit the responsibilities. Maybe someone will take charge, for example, of speaking with the doctors if they have more of a medical mindset. Someone could be in charge of taking care of legal or financial matters, just so you have that planned and thought out, perhaps in advance of a crisis. And that planning can reduce caregiver stress, right? So anticipating what the needs are for these kinds of responsibilities and caring from a distance, and setting that up in advance.
These are really great suggestions. And as a provider, these are things that, we suggest to families, for those that are trying to understand, what's right and what that next step is going to look like. And, for some of you, this might look like a really long list. So what we like to suggest too is just pick one of these areas. Just start somewhere. If you haven't had these types of discussions with your loved one, it's not always easy to start the conversation. And that's why these professional companies or services like Care Patrol or ComForCare can help in giving you some conversation starters, or even meet with you and your loved one. We wouldn't necessarily have any private discussions with you or your loved one, but we would certainly just start the conversation, say it might be a good idea to discuss this, and then we'll kind of lead you along that path, because it is important. And most of us haven't had these types of discussions with our loved one, but when you're distance caregiving, I think it becomes even more important.
So the second one is to get organized. And this is like planning and preparation. Being organized makes it easier and less stressful for caregiving in general, but particularly for caregiving at a distance. One of the things that can be really helpful when you're caregiving at a distance and you can't be eyes kind of in the room with your loved one is to set up systems for tracking and sharing information.
Absolutely.
And there's a lot of ways to do this now with technology. And you can, share a calendar or, through some kind of spreadsheet or whatever works for your group, tracking and sharing information between yourself and other family members and the care team. And also I would, just suggest your loved one to the degree that they're able so that they are part of that group and feel included. If you're someone isn't up to the technology, even keeping a simple notebook that someone can read from, for example, as needed, can be very, very helpful as well.
Agreed. And I couldn't agree with you more. And in fact, those are just some of the small tips that we like to share with families is if you haven't gotten a planner before, just go to Office Max or one of your big box stores and get one. It's amazing how just something like that, or even the notebook, like you mentioned, where you keep one notebook for that specific loved one or specific need. So that way you don't have scratched paper everywhere. That you can just jot down those notes or those, your loved one's getting ready to go to a doctor. Let's say you talk to them on the phone prior. You have a list of questions you can say, okay, well, let's make sure you ask these questions. Or even if your loved one has a doctor's appointment and you can't be there, oftentimes the physician will allow you to call your loved one and put you on speaker. So that way you can also engage in a conversation, even though you may not be able to be physically present.
And Stephanie, just to add to that too, sometimes, especially if your loved one has some cognitive challenges, you can track and see things in the notes that are there. So I'll give you an example. Oftentimes there can be something that can cause an increase in cognitive symptoms that's very simple, such as a urinary tract infection. That's not uncommon. And you might be able to track changes in the person's behavior. Maybe they're going to void more frequently, for example, or maybe they seem to be uncomfortable. And sometimes looking back over those notes can be an indicator to everybody, as a way of understanding maybe a change in behavior that might be like a prompt, like, gee, maybe something is going on, just looking back over everything that we're seeing here together. Agreed. So it can be a really great tool.
It can.
Communicate. When you're caring at a distance, staying connected and communicating with everybody on your team is really important. That goes, I guess I was getting ahead of myself a little bit there, right, with the notebook idea, because it goes to that idea about communicating about everyday events and other aspects of your loved one's well-being. It's a great way to find support from your team and to stay together as a team and to share the concerns and feelings that you have together as well. So there's really two aspects of this. One is communicating as a team in terms of the care of your loved one. So making sure you share information, as we talked about before. And it can also be a nice thing, like, we have these activities that people do in home settings, and it might be writing a note saying, gosh, we tried this banana crepe recipe together today, and mom really loved it. And that way someone knows that your mom, that she loved it, and maybe it's something you try at home, and then you sit, and talk about it over FaceTime together, right? So that is that level of communication. The other level of communication is as a caregiver to take care of yourself and to feel supported. So to talk about the feelings that you have, what your concerns are. I think that there's ways to, talk to your team in a way that's respectful, but is honest about where you are at, so that you can avoid feeling burned out and overwhelmed. Just a reminder, as we always tend to do, and again, it's hard to sometimes do, but it's worth reminding ourselves as caregivers to take care of ourselves, to take care of finding help for ourselves. Caregivers are very vulnerable to stress, as we talked about in our first of this webinar series, and you should look for help for yourself, including support groups. And, even if you are doing it over the internet, which many of us are now, And also speaking with your loved one and talking to them about their needs as much as they are able to be part of that process and talking with you.
Yeah, and for some of you that are with us tonight, if you are, if you have a Facebook account, it's pretty amazing how many support groups are even out there, in the sense of just like-minded groups that have created them on Facebook. Like, I know that there are, for example, like Care for the Caregiver. That's a group on Facebook. Or if your loved one has a certain condition, a lot of times there are Facebook groups out there that are designed just to support families that are caring for a loved one with that type of condition. And so it's really amazing, because you have these, thousands of people that join this group, and you can fill out something, and say, oh my gosh, this has been so hard today. And then all of a sudden you see all these people you don't even know respond and just kind of give you a, hey, that a girl, like keep up the good work, or we'll give you some of those tips. Or you could even ask questions like, have you ever tried this with your loved one? Or it's just really incredible to see how these support groups have even evolved as a result of COVID, and how it gives us a different form of communication and access to people that are going through similar things. I think is really supportive.
Yeah, absolutely. Next, identify your care resources. As Stephanie said at the top of this conversation, caregiving is a team sport. You need to find your teammates.
Yep.
And there are teammates for you out there. We talked about some family teammates. There are also teammates who are professionals who have a lot of experience in this area and who can provide tremendous peace of mind. So Stephanie, did you want to talk to these?
Yeah, absolutely. And I'm going to be talking about them in greater detail here in just a few minutes. But in terms of resources, especially caring from a distance, we always say, don't do it alone. Professional in-home care companies can help you every step of the way. And like I said, we can meet with your loved one. We can gather facts. We can help you identify what's happening in the home. And depending on what your goals are or your loved one's goals, we will find the right plan that fits everybody's needs. And the biggest thing that we can help you with is that communication. I think the hardest part about being a distance caregiver is just not being able to see your loved one every day and really know how they're doing. It's easy when we can call our loved one and say, did you eat today? That person can easily say, yep, sure did. But you don't actually know what's in their refrigerator, or if in fact they ate. And that in itself can be very, very stressful to a family. I don't know about you, but I'm always focused on the food. Is my dad eating? And so, these are things that home care companies can help give you that peace of mind, make sure that their safety is being maintained in the home. And of course, during COVID, we all follow CDC guidelines. So we're making sure that all caregivers are well equipped and educated, and making sure that they keep themselves safe along with your loved one. The other aspects to community resources is our partner with Care Patrol and helping you find community-based living. Sometimes, depending on the circumstances, keeping your loved one at home isn't always the right solution. And that's why there's community living that does exist. Not only do they get an apartment, but they have those prepared meals, they have that continuous oversight, and they have the benefits of also being able to see individuals who are in similar situations and age group as them. And so all of a sudden they might have an aspect of socialization where maybe in their home they didn't as much. So just depending on what those needs are, two great, wonderful resources for you to consider if you never have before are your in-home professional care companies, and of course those companies like Care Patrol that can help you identify the numerous community living options in your community, both of which can alleviate stress. We see families who have tried doing this for years on their own. When they come into our service, and within a few days, they're like, why didn't I do this sooner? So that's always my advice to families, is if you're considering it, if you're starting to feel that stress, just start to seek out those different resources and identify what it is that's available to you, knowing that in most instances you have a ComForCare or Care Patrol franchise location that can help you.
So next is just a reminder that when you are able to visit, to really make the most of your visit. And I would also suggest that this is true for when you're visiting remotely over FaceTime, or, I know in a lot of communities that we work with, the communities have made now times, if families still can't visit, to take into the residence room a smart pad where there's someone who works with them to help them with FaceTime. So even at those times, and I know we had a question kind of about this, just be sure to make the most of your time together and really set aside your time to be together. And what I mean by that is to go in, if you will, only with the expectation that this is going to be a set aside point in time for you both to find joy and companionship and connection and being together, not to get something done, not to kind of do a task or have that sense that this is a chore, but really to do something together. And, that can be something that is playing a game. Another thing I know a lot of people have tried to do at this time is to take this time to kind of write down the stories and to reminisce and to, keep track of all those things that are important that sometimes get lost if we don't write them down and we haven't had that opportunity. It can be a joint project right now, even if you're talking to each other at a distance, something that's engaging and fulfilling. And even those who have some mild cognitive loss can still remember things from their childhood or from the past that can be wonderful family memories and treasures that if you take the time now, you can collaborate together and, create even a little book. There's books out there now about grandma's stories, grandpa's stories, that kind of thing. But again, it's something you can write together in a notebook. You can videotape the person telling their story. And that's a wonderful way to engage them that reflects maybe who they are now, and not really focusing on what was. And that's especially when you have a loved one with cognitive loss, it can be really difficult to kind of set aside your expectation of that they behave in a way that they did before. Yeah. And so it can be really helpful to kind of in your mind, in your framework, take a deep breath before you go to your visit and just set the expectation that you're going to meet them where they're at. There's a wonderful TED Talk by a therapist about visiting her own mother who had dementia, and her mother was a Holocaust survivor and was her hero, and that the loss of her mother's cognition was so wounding to her. And she talked about finally one day just kind of meeting her mother on the bridge. So kind of leaving behind her expectations of who her mother would be and kind of meeting her in the place where they were at then together. And it was such a beautiful way of thinking about kind of making the most of your time together, setting aside those expectations. And then, using the technology to stay connected, whether you're able to be, you're physically kind of in close proximity, but you can't visit. And also if you're at a distance, the technology is, of course, been a lifeline for many folks as caregivers during this time. And as I said, if your loved one is having difficulty with the technology, there can be resources to help you, whether it's from, maybe someone on your team from home health, or a relative on your team who can go and get them set up, or even in senior living, as I mentioned, I know a lot of places have had the staff go in and make appointments with family members to have access to seeing their loved one using the technology.
And that is something that we have found. So for those individuals that we do care for that don't have the internet or even a smartphone, our caregivers actually will use their own, and they'll connect with that loved one and figure out a way to have a video chat or FaceTime connection where they can see each other. And it's interesting because we have one question from an attendee and asking just that, like, what do I do with my loved one that doesn't have the internet or a smartphone? So I actually heard a really interesting activity that one of our owners is doing, which I thought was really nice. And so this was the exact scenario, no internet, no smartphone. And so what they had coordinated is their loved one who lived in another state would actually prepare a box of activities. And so they put a few things in there, like a magazine that they both actually enjoy reading, and some kind of craft. I don't know exactly what they did, but they both had it. And so the loved one mailed it to their loved one in another state. And so when they got it, they just called them on the phone and said, what is this? You know? And so they opened it, and then they together actually used it as a means to just visit, you know, in a different way than just saying, what'd you eat today? How's the weather? And so it was
that's
like
great.
visiting.
It's a care package.
It was
right?
a care package.
It's a care package.
Yeah.
I also heard a wonderful story. We have a program that's an activity program that can be done in the home. And there's one of the activities is writing a letter to someone that you haven't seen in a while. And the home care provider did this activity with the person's loved one. And she wrote a letter to a cousin who was only 2 towns away, but they hadn't been able to see each other because of the pandemic. And then the cousin wrote back. And so now they've started this whole exchange, and she was so excited by getting a letter back and, you know, having that communication that they started to write to other people in the family and friends. And it's an old fashioned, you know, picking up and writing a letter, and that excitement about getting a letter back, but it also reestablished the connection at a time that it's been very difficult to do so. The only other thing I want to add here too, Stephanie, in response to that question, is there's a lot of programs also for older adults that are over the phone. So a lot of them are called Senior Centers Without Walls. I know that Mather, which is a organization in Chicago, has a telephone conversation series. I just was on talking to the folks on their program about brain health. So they have guest presenters. So that can be another way to do things that are intellectually engaging, that again are very low tech and just require being able to use the phone.
Yep. Great suggestion.
So then just to turn this around, and as we wrap up, I guess, and move towards the questions and the other things in the chat, you know, what is it that you'll do out of this? And as we said at the top, this isn't to give anyone more to do. We all, as caregivers, everyone has plenty to do, but hopefully there's something here that at least piqued your interest and sound like maybe that would help. And, you know, maybe there's one thing here or even 2 things here that will be worth trying from your perspective. And so just to take away from this, thinking about what would help you, what might be an idea here, a tip here that you'd like to try.
Absolutely. And I always like to say again, and I said it before, I'll say it again, in terms of, you know, pick one. Just start there and see what you can do, and implement it and try it out and see how it works and how it helps support you and your family. And of course, as we already mentioned, you know, professional services available in your community, like in-home care providers, can really assist you during these unusual times. I can't stress that enough. Our services, I always like to say, aren't just for our clients, they're for the families too. And a lot of times when we do meet with families and our clients for the first time, we'd like to get an idea of what everyone's goals are and kind of put that structure, plan, and that organizational approach behind it, so that, you know, you understand what you can expect from us, and we'll also communicate with you maybe even some new ideas that you hadn't considered before. Or maybe there's these different resources like Cynthia mentioned, like getting, you know, in-home grocery service provided, or other just conveniences that have just been sort of developed as in response to COVID that maybe you haven't been able to figure out yourself, that we can actually help you do. We can help set up those services. So again, we're not just providing the in-home care component and providing that support and safety in the home, but we can also help you identify what community resources are out there that can help you regardless of what your situation is. And so if you haven't had a chance to reach out to an in-home care provider, if you've been thinking about it, definitely want to encourage you to at least just take that first step, make a phone call, and find out what it is that a ComForCare home care agency can do for you. Not only can we be a perfect partner for you in the time of COVID, but really the communication, we can provide the clinical oversight to make sure your loved one is safe in their home and they're getting all the supportive services they need to help them thrive and find that meaning and connection, even in the time of COVID, is a goal of ours. And so as we reach those goals and meet them and have these wonderful experiences that occur in the home, we're going to share those with you. And those are things, like I said, that we can leverage technology, or caregivers have it when our nurses are in the home visiting, or even our owners, they could also connect with you virtually. So we're doing everything that we can to help you stay connected with your loved one and also help your loved one find that meaning and purpose while still staying safe in their home. The other aspect of community resources besides in-home care that ComForCare can provide is through senior community placement options through Care Patrol. So sometimes we find that, like I mentioned, staying in the home isn't always the right choice for an individual. And there's a lot of benefits of community living, like getting meals prepared every day, having an apartment in a building with other seniors as well, allowing for different types of socialization than maybe what they're getting today. So if you haven't considered or if you've been thinking about community living, Care Patrol is a really great resource to just give them a call and say, what communities are even available in my area? How much is rent? And what type of activities and what is it that they really offer? And that way you can really identify, well, what's really going to be best for me and my loved one given the situation. We always like to say that as a part of the conversation and making these decisions, we're always going to support that individual too, who's the one who's receiving the service or is considering that move. We know that in both instances, those aren't easy choices, both for the family and for that individual. So we do everything in our power to be respectful to those decisions and the process, and we're just here to support you and guide you every step of the way. So we're here to help. Again, you can reach out to me, Stephanie, any given time. I'm also going to follow up with all of you and share resources that you can consider after this webinar. So now we have some time for some questions and answers. I see that a few questions came in. I know that there was some really great questions surrounding the aspect that not all clients have the internet. So obviously, using technology in those situations aren't always easy. But I think we addressed that and provided some really great ideas. There's another
and
question.
Stephanie, sorry, I just want to add to that. There are products out there that are new to the market that, require kind of very little technical competence on the part of the person who you're caring for. So there's one, for example, called GrandPad. I know that some folks have asked me about. I don't know much about the product, but they have kind of like presets. You pre-program the pad, and it has very kind of large buttons that make it easy to access things like FaceTime, right? Or like photographs that you can preload or send. There's also photo frames. That's another thing we didn't talk about, but that can be a really great thing to send to a loved one. There's photo frames where you can then add, and actually all family members can add to the stream that comes into the photo frame, so that, and they don't have to do anything except gain the pleasure of seeing the new photographs as they get added to the frame. So there's things like that that are low technology on the part of the person who's the recipient that you can also take advantage of.
Yeah, those are great. And we have lots of resources like that too. So another great reason to reach out to your ComForCare Care Patrol locations. So one of the questions that came in is that, there's individuals who need support who are just missing contact from family or friends. So I think this actually came up in a previous webinar, in the lack of physical contact and the long-term effects that this can have on individuals. And obviously communities more in a facility setting, I guess, are doing a great job with utilizing staff and residents to get them outside and connect. But they can't leave the community, and this is leading to some loss of independence. So the question is any ideas, I guess, for those residents that are living in communities on any ideas for safe interaction and ways to get support maybe in how they are today?
Yeah, so that is a great question. And it has been a daunting challenge in communities. I think the first thing I would say is to contact the staff, because I think that things have changed, and they are very aware of the CDC guidelines. Many of the communities are following them and are having different they're able at different times to have different levels of activity. So some may have moved to physically distant activities outside.
Yes.
Some have returned to some small group activities or dining where everyone's tables are separated. In some communities, we're finding that the older adults are even though those community activities have returned, are still quite anxious about returning to the activities. So
Sure.
even though, for example, they might be able to go play bingo in the hallway, they're afraid of sitting out in the hallway. Then, you know, there was one woman I remember hearing that she didn't want to go on a Zoom call with her friends, even though it was being set up, because she didn't want to see anyone to see her with her hair not done. So these are very valid reasons. I mean, you know, I think, you know, right, many of us can really relate. But at the same time, I think it can be very helpful first to talk to the staff of the community and find out what is going on in the community, what the resources are, what their suggestions might be. You know, there have been accommodations for family visits now more and more, outside or in other ways. So I would really start there. And then I would look for ways to have fun together. It's such a difficult time not being able to physically be together. And you might be able to visit at a physical distance, but still not touch and hold each other. And that is very hard. So what are the accommodations allowed within the community? As silly as it sounds, some communities have set up these big kind of like shower curtain things to allow for hugs. Yep. Or maybe that there's someone else who your family member feels close to. It's not family, but it's someone in the facility who they can have a hug from because they're all kind of safe together in that community. But look for other ways to be together. I tried to mention some of them throughout in terms of, you know, creating a game together, doing a project together that's a family project that you've never had time to do before, and that kind of thing. So it's something new and engaging that's very satisfying, that builds on communication. I love the idea of the care packages, for example. And so, you know, those are a lot of different little ways to kind of engage in an, I don't want to use the word out of the box since we just talked about the care packages, but kind of in a different way. That's not your run of the mill, how was dinner, what did you do today conversation.
I know. And it is so tough. I mean, you know, and to protect everybody, the community at large and those residents that are living in a physical community, you know, it's important that we follow their guidelines. Like you mentioned, start with the community, see if there's different things you can do. You know, it was mentioned that, you know, residents can get outside. So sometimes it's even helpful when communities can even bring in, you know, different entertainment aspects, as silly as it sounds, you know, like different entertainers can come and still play outside, bring some joy and some comfort, especially while it's still nice out in certain areas of the country. And
I think this will get harder too with the holidays.
It will.
So, you know, thinking ahead to the holidays also, are there family recipe books that you've always wanted to do, right? Or do you want to videotape your loved one talking about, reminiscing with you about times, you know, around the holidays that were special to them, or, you know, creating some very special things around the holiday, even if you can't be together, to start to have some things that you can look forward to doing together.
Absolutely. I think that's a great piece of advice. Well, thanks to all of you. Really appreciate you attending. Some of you have also attended our 3-part webinar series, so it's been a pleasure to be with everyone. Thank you all for attending. We do have a Coping with COVID booklet that we will be sharing that has been written by Dr. Green on behalf of ComForCare and At Your Side and Care Patrol locations. So we'll be sharing that with everybody. If you need anything else in the meantime, though, please don't hesitate to reach out. Again, we say that caregiving is a team sport. You shouldn't do it alone. There are resources out there that can help you and guide you and make all kinds of suggestions in your community that can really alleviate some of the distance caregiving that you might be experiencing today. So thanks to all of you. Have a great evening. And again, please reach out should you need anything. And Dr. Green, most of all, thank you so much for bringing this wealth of ideas and strategies and tips and just walking us through some of these really difficult conversations. Really appreciate it.
It's been a pleasure to have the opportunity, and I hope that folks have found it helpful. So thank you all very much.
Thank you.